neck pain exercises. Let the bone move down. Get the rest of the zones of the muscle. You're massaging between the shoulder blade and the spine. So now I'm just going to show you some simple exercises that you can do to help your neck pain. Now, a lot of the times, neck pain is simply due to a muscular spasm. Let's say you're working at the office, you're sitting at the desk for long hours, driving for long hours, you tend to develop a lot of neck muscle spasm because of the head position. Let's say you're driving, probably like this, the computer head is tilted forward. A lot of the times you're on the smartphone and the head is down like this. So that puts a lot of strain on the neck muscles. So we're going to do some exercises to help to release the tension in the neck muscles, and not just the neck muscles, but also on the trapezius muscles up here, and also as well between the shoulder blades. So we'll start with some simple stretching exercises. So stand or you sit, let the head tip like this, a bit of a stretch. Next side, stretch, hold for 20 to 30 seconds. You're going to feel a bit of a pull here. Sometimes you're going to feel some pain here too as well, depending on how tight the neck muscles are and also which muscles are affected. Before I get a bit more of a stretch, gently put some pressure on the head. Next side. Again. Okay, so this neck exercise is going to help again to loosen the neck muscles. So you want to move the head side to side. Initially you may not get it, but with some practice you can look in the mirror and then eventually you'll be able to get it. Eventually you're going to work up to this movement. Side, 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 side. Again, when you're now starting off, you may end up doing this or this. Okay, this is not the exercise. Okay, keep your shoulders where they are. I'm thinking about moving the head, sliding the head, sliding the head. When doing this exercise, it's quite normal to feel some burning around the eyes as well. That's normal. What you can do is something called the chin tuck exercise. So as the name suggests, is you're going to tuck the chin. So you'll do from the side and you're going to make a double chin. So you're going to do this. Double chin. Double chin. Double chin. Okay? It is very easy to look downward or look upward when you're doing the exercise. Some people end up doing it like this or like that. It's not a downward head movement or an upward head movement. It's almost like you're drawing the head straight back. A lot of you are going to feel some tension behind here as you draw the head backward. Now sometimes the neck is so stiff you're unable to really get that movement. So all the trick you can do is to throw the head forward first. So you do this. Instead of starting here and doing that, you can throw the head forward first, then come back. Forward, then come back. Okay, so you do this around 10 to 15 times. If you're feeling dizzy or you're feeling any sort of tingling or numbness running down the hands, you need to stop. Okay, so this next exercise is the opposite of the chin tuck exercise. I just call this the nose to ceiling exercise. What you're thinking about, it is the nose going towards the ceiling. Yes. Head is leaving the mark. Hold it for a couple of seconds. Slow. Nose towards the ceiling. Try to touch the ceiling with your nose. And back down gently. Now you can do an addition to the exercise. When you're up, turn to one side, turn to the next side, neutral, back down. Okay, this is a bit more of an advanced exercise. I don't really advise you do this on the first attempt. Just get accustomed to this first, but then you can turn and back down. So another neck exercise you're going to do is the chin to chest exercise. You do this on your bed or on the exercise mat. This one is different from the nose to ceiling. This one is chin to chest. Get the target the muscles at the front of the neck. And relax. Up again. Hold for a couple of seconds. Gently. Up. Control the movement. And then you can do the reverse. Gently let the head forward. Try to look towards the ceiling. Gently control the movement. Up. Come back down. Control the movement. Just 15 to 20 times or what it is you are capable of. Okay, so there's a way in which you can also massage your neck muscles. A lot of the time, you have a lot of pain running here and here. So what you're going to do, you're going to use your thumbs to massage your neck, but you're not going to use the tip of the thumb. You're going to use the joint right here. So instead of pressing into the neck like this, you will use here instead. It's better that way. Very preferably do this when you're sitting down. You're going to feel those tight spots on the neck. Do a slight massage. Again, if you're feeling any sort of dizziness or something does not feel right, you need to stop the massage. So a lot of you may have heard about neck traction. And this is a home device. It's an inflatable neck traction device. You're going to put this on like this. Turn. Close the valve. You're going to pump this up. As you're pumping up the device, it's going to start to inflate and it's going to start to stretch the neck. Come to the point where you feel comfortable, not pain. Now, preferably you do this exercise when you're sitting down. I'm demonstrating it standing up for it's a bit easier to do this right now, but be sitting when you do this particular exercise. Don't leave it here for very long. 5 minutes max if you're a beginner. And when it's done, the device, you just open the valve and the device deflates, taking pressure off the neck. So in the picture of neck pain, it's not just about the neck but also the trapezius muscles. A lot of you also have tightness between the spine and the shoulder blade in this zone right here. So you're going to use a tennis ball to do a massage on that zone between the spine and the shoulder blade, not directly on the spine. You find some of those tight spots or those knots and then you can hold it here. Do some focus massage like this right here. Here. Let the ball move down. Get the rest of the zones of the muscle. You're massaging between the shoulder blade and the spine. You're gonna feel those tight spots, put some extra pressure, all the extra focus work. Yeah. Sometimes you may feel a bit of a tingly sensation running down the hands. As you press those tight spots, you can also let it then move it down a bit further. Up and down. Roll that ball around. Just really massage those muscles out, and then you do it for the other side as well. So we're just going to do some work on this part of the trapezius as well. So stand and you're going to shrug and you're going to tense these muscles to help to release tension. So when the muscles are tight, by doing a tight contraction and releasing the muscle, you can drop the overall tension in the muscle. Stand here and you try to touch the shoulders to the ears, the fingers like that. Really squeezing, but as you feel a bit of a cramping, that's fine. And you relax. Up again, really tight, hold it for 5 to 10 seconds. Again, you might feel those muscles really cramping up on you. That's normal when your muscles are tight, and you relax. Okay, so you do that around 10 times on average to help to really relax the trapezius muscles, which can also contribute to your neck pain. So the high face pull can be used for neck pain. So you can get a resistance band, or if you're in the gym, you're on the cable machine. You do this exercise, you can do it with one or both hands at the same time, depending on the length of the bar. So I'll be doing it one side at a time. So face the machine or you face the band in this position, and now you're going to pull, and the bar is going to go above your head. The bar is not coming towards the face, it's above your head. Like this. Control. Pull. See how the handle is above my head. I'm going to feel that tension in the trap muscle. Control, don't let it just pull you forward like that, or you'll get a shoulder injury. If you're using a resistance band to get more resistance, of course, you just step back a bit more above your head. Okay, so this is great for really relieving the tension in the trap muscle, which can ultimately lead to less neck pain. Okay, so this is the device. It's called a peanut massager. You can get this on Amazon. So the idea is that you lie down on it, and this here is going to massage the muscles of the upper back, and you have this dip in the center so that the ball doesn't actually roll on the spine. Great. So now you're taking the peanut massager, putting it in the upper back right here. Notice how the dip here protects the spine. The spine is not massaged by the ball, which can actually be pretty painful. You don't want that. You bring yourself up using your legs, roll backward and forward. And you can appreciate how the ball really digs in to those tight muscles. Slow, really find those tight spots, hold it there, rock side to side to really get the tension out. Sometimes when you do this maneuver, when you press on the tight muscles of the trapezius or the muscles by the shoulder blades, you may feel some sensation running up the neck into the head sometimes. That's probably pretty normal, but if you're getting dizziness or something does not feel right, then you need to stop the exercise. Now, in the picture of neck exercise, What you also have is lack of mobility of your thoracic spine. That is going to be this part of the spine here. Okay, so the mid-back, if you want to call it that. So we need to work on the mobility of the mid-back. Again, when you're driving for long periods of time, we can lock the back in that position. Sitting at the office for long hours, again, you can lock the back in that position. And that, of course, can contribute to your neck pain. So using a foam roller, it doesn't need to have these knobs on them. It can be smooth as well. You're placing the roller mid-back, as you can see there. Put your hands behind your head. Lean backward, try to get the head to touch the mat. Back. Really try to get mobility of the mid-back or the upper spine. Gently. In doing this exercise, you may feel some cramping of some of the muscles of the back. It's normal for that to happen. If that is happening, just get up, take a break, stretch, and go back in. You really need to loosen that upper back and contribute to a reduction in your neck pain. So now I'm going to show you some more advanced neck exercises. These exercises are not for everyone. If you have high blood pressure, this is not for you. In our history of dizziness, this is not for you. History of pinched nerve or stroke, this is not for you. This is for healthy people with some neck muscular tension. But the head is going to be hanging off the edge of the bed. You need to let the neck come down slowly and control. Get a bit of a stretch there. Now if this is the first time you're doing this and you're getting dizziness or something does not feel right, stop the exercise. So no swinging of the neck in either direction. You can also alter the movement. When you're coming up here, you hold and now nose to ceiling. Down. Nose to ceiling. Down. Okay, that could add a bit more variety and complexity to the movement. Engage some different muscle groups. And down. So for this next exercise, you're going to turn onto your belly. Head is going to be off the bed. Okay, and now you're going to let the nose fall towards the floor. So it's a chin tuck, but while horizontal, this is going to be a bit more difficult than your typical chin tuck because now you're working against gravity. Then when you reach here, you can also look up towards the ceiling, compact level, nose towards the floor, chin tuck, look towards the ceiling, nose towards the floor. Remember, hypertension, dizziness, stroke, herniated disc, do not use these exercises. So now we're going to exercise the muscles on the side here. Again, using a bit more advanced exercises. This is not for everyone. In history of high blood pressure, dizziness, stroke, or herniated disc, do not use these exercises. But come to the edge of the bed. Let your hand hang like this. Hand is off the bed. On your side. Let the head drop to the side. Maybe stretch. Straighten up. Okay. Using the hand is off the bed here, that you don't want to put any pressure on your shoulder. And when you're done, you flip to the other side. Hand is off the bed. Let the head drop. Then there's a stretch right here. 1 to 2 seconds hold. Stretch. Really great way to stretch and strengthen the muscles on the side of the neck. Use with caution. Any doubts, any queries, speak to your doctor or registered physiotherapist. So again, this is, if you can appreciate making the neck mobile by doing these exercises, this also helps to alleviate pain. When the muscles are tight, by taking the neck through a certain range of motion, you train the muscles to loosen, you train the muscles to have less tension, and that is going to lead to less neck pain.
If you're suffering with neck pain, you can call us today at 7475297 or 3083370 to book an appointment. You can tap the description below for all of our contact information.